A number of studies presented here at ACC 2015 in San Diego are simultaneously published in JACC. So what we would like to do is take a look at one of those papers. It is the 5-year outcomes of the PRECOMBAT study, and I'm with Dr. Seung-Jung Park, who is an MD, PhD, and professor of medicine at the University of Ulsan College of Medicine and chairman of the Heart Institute of Asan Medical Center in Seoul, South Korea. First, PRECOMBAT. Let's talk about the background. What is the study?
The initial result of PRECOMBAT studies was published in 2011. Actually, the study was organized comparison PCR with the bypass surgery for the main disease, focus on the main disease. That is the first randomized study. And this study was followed at 5 years, and we found actually PCI versus with a cyphosine and bypass surgery, actually not too much difference. It's not statistical difference in terms of a primary endpoint, death, MI, stroke, and ischemic driven TBR. Actually, we didn't find any statistical differences. Absolute number is a little bit different. Surgery is 14%, and PCI group is 17%. It's a little bit higher in the group of the PCI. However, overall, not too much difference between the two. And if you look at the inside, the heart endpoint, there's MI, stroke, and any micro infarction, no difference at all with the PCI versus bypass surgeries. However, still, there are some ischemic-driven TBR, including the angio-guided, TBR, a little bit higher. So that is only, positive data between the PCI versus surgery.
So for patients with left main coronary artery disease, what's the lesson here? What do we learn to take away from PRECOMBAT?
Right. If you look at any other multi-vessel study, right? Multi-vessel PCI versus surgery is clear, even in the era of a drug stent, surgery is clearly superior to the PCI with any drug stent. Concern is, however, the main disease, the main intervention is totally different concept, different data, and so we clearly demonstrate the following concept. And the main disease is conceptually more complex disease subset. However, if you look at the current guideline concern, is not, very much, 2A indications, one osteochapter region 1, class 1 indication. The meaning is main PCI is quite acceptable, rather than the surgery. There's a big change from the last almost 15 years. It was changed a lot, and so I believe main disease is good, target for angioplasty, PCI.
An encouraging study, to say the least. This is a JACC simultaneous publication, so as we are standing here in San Diego, it is online for you at JACC. For CardioSource World News, I'm Executive Editor Rick McGuire.